In this video, I will answer these questions: what is Alzheimer? What are the Alzheimer symptoms? How is Alzheimer's diagnosis? And how is Alzheimer's treatment? With the improvements in the field of health and the improvement of living conditions, human life has prolonged. Diseases such as dementia with the prolongation of human life are becoming a greater problem of society day by day. Dementia is one of the most common diseases in the elderly population. Alzheimer's disease, AH, is the most common cause of dementia. Recent studies show that approximately 47 million people in the world live with dementia. It is estimated that this number will be doubled every 20 years. Alzheimer's disease is a neurodegenerative disease in cognitive functions such as memory, attention, executive functions, visual spatial skills, and language skills. Alzheimer's disease is often seen in the population of 65 years and over. However, it may also occur in the age of 65 and below, and this is called early-onset Alzheimer's disease. In the diagnosis of Alzheimer's disease, brain imaging methods such as neuropsychological assessment and structural and functional MRI, positron emission tomography, electroencephalography are frequently used methods. However, the use of these methods alone is not sufficient for diagnosis. Therefore, it is important to use methods together. Alzheimer's disease's neurological finding is weak, especially in early stages. Therefore, neuropsychological tests are of great importance in determining the diagnosis and progression of the disease. The general characteristic feature of Alzheimer's disease, which is seen in advanced age, is that it starts with progressive memory disorder and continues with the widespread deterioration observed in all cognitive functions with the progression of the disease. Early-onset Alzheimer's patients exhibit a different profile in neuropsychologically compared to late-onset patients. What are the Alzheimer's symptoms? Alzheimer's patients usually use clinics with complaints of low performance in cognitive and behavioral fields. Although the symptoms of the initial stage of the disease are lighter, the findings are more pronounced in advanced patients. Although symptoms of the onset of Alzheimer are generally small memory problems, but forgetting the recent conversations and events, it contains symptoms such as the inability to remember the names of people, objects, and places. Alzheimer's symptoms, which are most commonly seen with the progress of the disease, are blurry of consciousness, forced to adapt to the environment where the person is located, disappearance where a person knows well, problems with speech and language skills, the development of personality disorders such as aggression, unusual demands from family and friends, doubt the environment, hallucination and delusions, motivation and low respect. It has difficulty in making people's daily activities without help, denying events that one cannot remember, anxiety and depression. These symptoms are usually frequently seen in the period when the disease is first diagnosed. With the progression of the disease, these symptoms increase the severity of the patient and reach a much more advanced dimensions, such as the fact that the patient cannot recognize family members, to completely forget his recent past and have difficulty in recognizing himself. In this case, patients usually become in need of a caregiver so that they can survive their daily lives. How is Alzheimer's diagnosis? There is no differential diagnostic test that can provide clear information about the diagnosis of Alzheimer's disease. Therefore, many medical diagnostic tests are evaluated together in the diagnosis of the disease. Patients who apply to health institutions with symptoms of the disease are directed to neurology clinics. The patient's story is taken by the neurology specialists. At this stage, some questions may need to be asked to the patient or his/her close environment as well as the patient. After the medical story is taken, various scans are performed in patients measuring neurological functions, balance, sensation, behavior, memory, and reflexes. Blood tests, ultrasonography, computed tomography, CT, magnetic resonance imaging, MR, and personality scanning tests for the investigation of the presence of similar diseases can also be applied in order to support diagnosis and to exalt the possibilities of similar diseases. Since Alzheimer's disease may show similar symptoms with some genetic diseases, gene screening may also be applied in order to investigate these diseases. In addition, gene screening for the investigation of the ApoE4 gene, which is claimed to play a role in the development of Alzheimer's disease, can be applied, but this method is not a proven screening method. As a result of all these diagnostic tests, in case of increasing suspicions about Alzheimer's disease, tests can be made by the physician after tests for the evaluation of cognitive functions, also known as Alzheimer's test. How is Alzheimer's treatment? People who have the above symptoms indicate Alzheimer's disease should consult a health institution without wasting time. As a result of the evaluations to be made by the physician, the treatment process in patients receiving Alzheimer's diagnosis is planned as personally considering the age of the patient, the level of progression of the disease and other accompanying diseases. Alzheimer's disease has no known treatment method. However, with some applications, it is possible to reduce or eliminate the symptoms caused by the disease in the patient and to slow down the progression of the disease. Necessary arrangements should be made in the home environment of Alzheimer's patients, and especially for patients who have to live alone, measures should be taken at home to prevent forgetfulness and facilitate remembering. These may be notes or remarkable signs to be hung on certain parts of the house. Psychiatric therapies, which can be applied individual or collectively, such as cognitive stimulation therapies, can contribute to strengthening memory, problem solving, and protecting language skills. The physician may be recommended by the physician in order to reduce symptoms of the disease and improve the quality of life. Dongesterase inhibitors such as donepezil, rivastigmine, Tacmin, and drugs such as memantine are the most commonly used types of drugs for this purpose. These drugs are not directly for the disease-oriented treatment, but can be considered as part of symptomatic treatment. In individuals who have an Alzheimer's history but have not yet been diagnosed with the disease, measures can be taken to eliminate risk factors, since the cause of the disease is not known. These are measures such as avoiding smoking, adopting moving lifestyle, and eating healthy. In addition, these individuals should be aware of Alzheimer's disease and symptoms indicating the disease. If you are observing Alzheimer's symptoms such as memory problems in yourself or in a relative, you should immediately consult a healthcare facility and have the examination and required diagnostic tests for the investigation of the disease. If the disease is diagnosed, you can significantly slow the progression of the disease by ensuring that the treatment process starts as soon as possible. In this video, we talked about simple general information about Alzheimer. Don't forget to follow and like it for more detailed videos. Take care of yourselves.